Hello everyone, welcome to another question and answer session from the physiology part of MRCS part exam. Here the question, first of all, read the question very carefully. A homeless 42 years old male had an emergency inguinal hernia repair 24 hours previously. He has a BMI of 15. He has been put on a nasogastric feeding regimen of 35 kilocalorie per kg per day with no additional medications. The nursing staff contact you as he has become confused and unsteady. On examination, the patient is disoriented to place, has a diplopia and nystagmus. What is the most likely diagnosis? So after careful reading, now the key point here, we can see the BMI is 15, which is very low for a patient, and the patient receiving 35 kilocalorie per kg per day, which is the high calorie intake. The nursing staff contact you that after taking this type of food with no additional medication, patient become confused and unsteady, and on examination patient is disoriented to the place, has diplopia and nystagmus. That means this is the clinical feature of central nervous system malfunction. Now the answering options, the options are cerebellar stroke. Here we can see this is the cerebellar stroke, acute dystonic reaction, cerebrovascular accident, Parkinsonism, and Wernicke's encephalopathy. So we have to find out one of the option. Again, here we can see BMI is very low. That means 15, and the patient is taking a high calorie food, which is the 35 kilocalorie per kg per day, with no other medication. Now the patient is confused, unsteady, disoriented to place, diplopia and nystagmus, which are the clinical feature of the central nervous system dysfunction or malfunction. Now we have to find out the cause of this patient. So here we can see, first of all, let's see the Wernicke's encephalopathy. Here we can see the Wernicke's encephalopathy. It is caused by B1, that means the thiamine deficiency. So Wernicke's encephalopathy, it occurs due to vitamin B1, which is the thiamine deficiency. And here we can see what are the causes. Here the options are the chronic alcoholism, malignancy, hyperemesis of pregnancy, bariatric surgery, and anorexia nervosa. And here the clinical feature, here we can see memory impairment, ocular dysfunction, cerebellar dysfunction, and nutritional deficiency. So from there, we now treatment is immediate treatment as early as possible, which is the administration of glucose with thiamine. The next slide, here we can see it is the etiology of the Wernicke's encephalopathy. Here we can see the thiamine. The thiamine plays a vital role in metabolism of the carbohydrate in different metabolic pathway of carbohydrate metabolism, and it acts as a cofactor of different essential enzymes. And if the vitamin B12 is absent, then different pathway will be stopped. Here we can see the Krebs cycle and pentose phosphate pathway and other pathway. Thiamine plays important role as a cofactor. At thiamine deficiency, thiamine-dependent cellular synthesis begin to fail and resulting eventually cell death. Thiamine-dependent enzyme an essential role in cerebral energy utilization, propagate brain tissue injury by inhibiting metabolism in the brain region with higher metabolic demands and high thiamine turnover. That means in the absence of the thiamine, the metabolism is reduced and the brain tissue is highly susceptible to injured due to hypoxia. So first of all, the symptom from the brain develop, then other parts of the body. Now see some important reaction here. Here we can see this is the thiamine, which is required during the oxidation of pyruvate to acetyl CoA and oxidation of acetyl CoA in the TCA cycle or Krebs cycle. So if the thiamine absent, the oxidation of the pyruvate to acetyl CoA is not possible. So we giving large amount of carbohydrate, but we getting very low amount of the ATP and the production of the other waste product. So we know that during the glycolysis process, only 8 ATP is produced. But in case of Krebs cycle, there is a huge amount of the ATP is produced. When there is a reduction or there is loss of oxidation, that means there is loss of oxidation of the pyruvate to acetyl CoA. That means this substance cannot enter into the Krebs cycle. That means larger amounts of the ATP is not produced, because oxidation of glucose to pyruvate it produce only 8 ATP, but oxidation of the glucose uh, and enter into Krebs cycle, it produce about 38 ATP, which is more ATP. And if the pyruvate not converted in acetyl CoA, the pyruvate also converted into lactate, and this lactate converted into the lactic acid and produce acidosis. So the stop of oxidation of pyruvate to acetyl CoA and oxidation in the Krebs cycle, it will develop the less amount of ATP but more amount of acid. Then second, here we can see also the HMG shunt. The HMG shunt, it also plays important role in different part of the body. When thiamine is absent, that means B1 is absent, and we are giving larger dose or bolus dose of the carbohydrate, it will not work in HMP shunt. And HMP shunt, it plays many role in our body, in different part of the body and including the different organ. There is another picture. Here we can see alpha ketoglutarate to succinyl CoA, which is one of the important pathway of the Krebs cycle. It also stop its function, so it is not possible for the patient making more amount of the ATP, but this cycle producing the lactic acid. Now here we can see this is the triad of the Wernicke encephalopathy, acute confusion, ataxia, and ophthalmoplegia. So it is triad of the Wernicke encephalopathy. Acute confusion, ataxia, and ophthalmoplegia if developed, then it is confirmed of Wernicke encephalopathy. Then here we can see another slide, Wernicke encephalopathy or syndrome. It is occurs due to the thiamine deficiency, also in seen in chronic alcoholism or chronic malnutrition. Wernicke's encephalopathy, it's triad of ophthalmoplegia, ataxia, and confusion, and also amnesia and confabulation in Korsakoff syndrome, and its treatment giving the thiamine followed by the glucose. Then some important in this patient, the patient received carbohydrate rich diet without any thiamine or B supplement. For this reason, vitamin B1 supplement not given. For this, the carbohydrate it converted into the pyruvate and lactate, but giving only 8 ATP instead of 38 ATP. That means the about 30 ATP less in one reaction. So it is very few ATP. Then it leads to Wernicke's encephalopathy, which is classically present with confusion, ataxia, and ophthalmoplegia. And it is associated also with the chronic alcoholism. So here now our answer is ready, as it is the Wernicke's encephalopathy. Why it is Wernicke's encephalopathy? Because the BMI is very low, which is the 15. So very low BMI patient, he has no B1 or less B1, and we giving 35 kilocalorie, which is more calorie. So the more glucose it converts it into the pyruvate, but it not able to enter into the Krebs cycle and produce more ATP. And as this process, the patient is confused and unsteady, and it is he is disoriented to place diplopia and nystagmus. Other options such as the cerebellar absorption stroke, which is not true, because it develops some other clinical feature also. Acute dystonic reaction, not true. Cerebrovascular accident, not possible, because it develop hemiparesis or hemiplegia or monoplegia or diplegia, etc. And Parkinsonism, it is also true. So our option is the Wernicke's encephalopathy. Thank you all.